group, and welcome to Unit 15. Today we're going to discuss tumor immunology. Okay? Tumor immunology, here we have an evaluation and investigation of when cells proliferate and produce masses rather than trigger a reaction or inflammatory condition. We can use tumor markers for guiding the course of cancer therapies. So let's get into the lecture. Let's go ahead and start with some terms that you want to be familiar with. Okay, so neoplasm is just a fancy name for tumor, really. It's an accumulation of cells derived from a single cell. Oncology is the study and treatment of tumors. Cyst is an abnormal collection of fluid within a sac or cell wall. Tumor is a new and unusual growth of tissue. It is a proliferation of cells which produces a mass rather than causing an immune reaction or inflammatory condition. Okay? Benign is a non-spreading mass that's not malignant and it is surrounded by a capsule. This is considered a slow-growing tumor. Malignant is an uncontrollable growth that tends to come back after initial removal. It can be fatal, or in fact it's usually fatal with no treatment, and it is not surrounded by a capsule, so it's particularly invasive. The term cancer refers to a malignant growth of tissue with a tendency to metastasize. And what I mean by that is it spreads to other tissues or leaves the primary location that it began in. Okay? A primary tumor is a tumor in its original site of origin, the original place that it occurred. A secondary tumor is one that is spread from the primary tumor. Carcinoma is cancer of the epithelial cells or skin cancer. Sarcoma is cancer of the non-epithelial connective tissue. For example, one such type of sarcoma could be osteosarcoma, which is bone tumors, or a lymphosarcoma, which is a lymphoid tissue. We also have things like leukemia, which is cancer of the hematopoietic tissues, neoplasms arising from the bone marrow cells. And then we have a lymphoma, which is a lymphocyte malignancy or a malignancy of their precursor cells. The leading causes of cancer are lung cancer, colorectal cancer, and breast cancer. Okay? Cancer is more likely to occur in men than in women. And cancer is the second leading cause of death among children 1 to 14 years old. And you might be asking yourself, well, what type of cancer is that? And the primary cause in kids is acute lymphoblastic leukemia. Now, there are a number of things that contribute to a person possibly getting cancer. And that could be things like chemicals, viruses, ultraviolet light. You could have a genetic predisposition to cancer or certain medications. So let me give you some examples of these. Some chemically induced tumors would be things that are environmental, such as asbestos, lead, tobacco, radiation. These are all considered chemical induced tumors. Then we have viruses that can lead to cancer, such as Epstein-Barr virus, HIV, and human papillomavirus. Ultraviolet light exposure can cause skin cancer. Genetic predisposition means you may have a chromosome abnormality that causes cancer. And then there are certain medications like steroids and estrogen that can cause certain cancers. Now, there are a number of different body defenses in response to cancer. Okay, for example, our T cells, especially our T cytotoxic cells or T cytolytic cells, they can actually lyse the tumor. We've got natural killer cells that are involved in the immunosurveillance against developing tumors, so they're kind of the watchdog for potential tumor cells. We have macrophages, which produce the cytokine tumor necrosis factor, and that kills the tumor by direct toxic effects. We have antibodies that can be produced against tumor antigens. And then we have lymphokine activated cells. And finally, interleukin-2. So our lymphokine activated cells and our interleukin-2 both have tumor killing properties. There are a number of stages associated with cancer. Usually those are referred to as stage 1 through stage 4 cancer. Okay? The stage 1 cancer is the induction phase of cancer. Okay? This is when the normal cell is exposed to a carcinogen. The DNA is damaged and the chromosome breaks down, and the cell is transformed to a cancer cell. Okay? If cancer is caught early in this stage, you're usually able to suppress the cancer unless the cells are malfunctioning. In the in situ phase, this is called the localized stage of cancer, meaning that the cancer is localized and not yet spreading. Here, cancer begins when a transformed cell develops into cancer, and it ends when cancer invades the surrounding tissue. Recovery again is quite possible if it is caught in stage 2. The invasive stage of cancer is called stage 3 cancer, and this is when the cancer has spread to the other tissues. Cancers gain access to the blood vessels and the lymphatic channels. And then finally, stage 4 cancer is known as the dissemination phase, and this is where the cancer starts to metastasize. So let's talk about tumor markers and their functions. Okay, tumor markers are biochemical substances associated with tumors. They're used to guide the course of cancer therapies, and they're released into circulation in the blood and body fluids when somebody has cancer. Now, tumor markers can be enzymes, hormones, oncofetal antigens, glycoproteins, or cytokines. Okay. When normal cells are transformed into cancer cells, unusual antigens commonly appear on the neoplastic cells. Some genetic predisposition to develop some cancers occurs in humans. Environmental factors are also known to predispose a person to certain cancers like lung cancer. Okay? So these tumor markers or antigens on the tumor cell, or hormones or enzymes, etc., these proteins that are produced by the body in response to cancer growth, are sometimes used to screen for cancer. Okay? And then sometimes they are used to monitor the reoccurrence of cancer, and they are also used to diagnose cancer. Okay? So tumor markers are used to screen for cancer, diagnose, determine what stage the cancer is in, to grade the treatment or guide the treatment, to monitor treatment, and finally to determine the probability of its reoccurrence. Okay? We have a couple tumor antigen categories. One category is called a tumor antigen category, or tumor-specific antigens. These are antigens that are very specific to that organ or tissue. Okay, one example of a tumor-specific antigen would be prostate-specific antigen, prostatic acid phosphatase, and carbohydrate antigen 15-3. These antigens are not normally found on regular cells or normal cells. They don't cross-react between different tumors, and they are caused by some carcinogens. So these antigens are specific to different body sites depending on where the tumor is formed. Every tumor caused by a chemical agent has a unique surface characteristic. Okay? Tumor-specific antigens can be induced by viruses like Epstein-Barr virus or nasopharyngeal carcinoma, or tumor-specific antigens can be induced by chemicals, and that would be things like hydrocarbons in cigarette smoke. A second type of tumor antigen are known as the TAAs, the tumor-associated antigens. Okay? The TAAs are cell surface molecules synthesized by the host cell, and they are antigens on a virus. It doesn't matter what type of cancer a person gets if antigens are specific to a virus these antigens are specific to a virus that induced it. Each specific virus induces the same antigen despite which tissue is the origin of the cancer. Okay? Some examples would be B-cell cancer and Burkitt's lymphoma. This is a cancer of the jaw and face. Okay? Or herpes simplex 2, which leads to cervical cancer, or it can lead to cervical carcinoma. Each specific virus induces the same antigen despite which animal species is affected. It looks like we have one more type of tumor category antigens, and that is the carcinofetal antigens, or the oncofetal oncofetal antigens or oncodevelopmental antigens. The oncofetal antigens would be things like CEA, which is carcinoembryonic antigen, alpha-fetoprotein, carbohydrate antigen 125, and beta-HCG. These are normally expressed in the developing fetus but are absent in normal adult tissue. Cancerous tissue secretes these fetal gene products. They are a type of tumor-specific antigen, and a fetal gene product secreted that normally is not secreted in adult life is a carcinofetal antigen. And yet another type of tumor antigens are spontaneous tumor antigens. Okay, the three previous are tumor-specific antigens, tumor-associated antigen, and carcinofetal antigens. In the spontaneous tumor antigens, these tumors are not caused by any specific mechanism, but they may produce certain antigens, okay, or markers used to monitor or screen for cancer. The clinical importance of these spontaneous tumor antigens is unclear at this time. Some examples of specific tumor markers would be things like alpha-fetoprotein, carcinoembryonic antigen, carbohydrate antigen 125, carbohydrate antigen 19-9, PSA, and beta-HCG, and we're going to talk about these. Alpha-fetoprotein is a marker found in fetal serum but not in adults. Not in adult serum unless the patient has cancer. In primary hepatomas, a metabolic shift of the liver tissue occurs, making the tissue revert back to fetal-like state, so alpha-fetoprotein is then produced. It is normally synthesized by the fetal liver and yolk sac. It is elevated in liver cancer, and it can be elevated in non-cancer conditions such as hepatitis or cystic fibrosis. It is a reliable marker for monitoring chemotherapy and radiation treatments. Carcinoembryonic antigen is also known as CEA. This tumor marker is normally found in fetal endocrine tissues in the second trimester of pregnancy. It can be elevated in colon, lung, breast, pancreas, and liver cancers, and even cancer of the digestive tract. We use CEA to monitor tumors. It's not a good marker for screening to see if someone has cancer, as it can be normally elevated in people that are older or in people that smoke. It is usually elevated 2 to 3 months before any other symptoms of cancer appear, and it is usually identified through radioimmunoassay. CA-125 is elevated in certain types of ovarian carcinomas. In fact, we use CA-125 to diagnose and monitor those ovarian carcinomas. Elevated levels can be seen in pelvic inflammatory disease and endometriosis as well, but is most useful in the diagnosis of ovarian carcinoma. Carbohydrate antigen 19-9 is elevated in pancreatic and gastrointestinal and breast cancers. It's also elevated in liver and colon cancer. It is more specific for pancreatic cancers than CEA. Beta-HCG is a sensitive tumor marker. There's actually two types of HCG. One is called alpha-HCG and one is beta-HCG. But beta-HCG is pretty unique and not closely similar to any other hormone. And so we look for human chorionic gonadotropin, the beta-HCG, in certain tumors. It is a sensitive tumor marker, and it's elevated in sinus tumors and small cell lung cancer of the bronchioles. Prostate-specific antigen is associated with prostate cancer. It's present in the cytoplasm of both benign and malignant prostate epithelial cells, but in no other tissue. So this marker is organ-specific, but not tumor-specific. It is only found in the prostate and not tumor-specific. Prostatic acid phosphatase is an isoenzyme found in greatest concentration in the prostate. If levels are elevated in prostate cancer, but can normally be found in the liver, brain, lung, heart, and spleen. So it is not organ-specific in prostate cancer. Some laboratory tests we can use to detect tumor markers would be things like lymph node and bone marrow biopsies. Okay, here we're looking for lymphomas and leukemias. We're going to look at lymph node and bone marrow biopsies. We're going to look at CBCs because high white cell counts can first indicate leukemia. We want to do differential blood smears and bone marrow smears and antigen phenotyping on leukemic cells. ELISA is also used to diagnose cancers, and so is radioimmunoassay. We can actually look for immunoglobulins when mixed with radioactive antigens. And then we can do FISH, which is fluorescence in situ hybridization, which is a molecular technique using fluorescent probes and looks at DNA to diagnose cancer. And then finally we can use PCR, which of course is a molecular way to identify tumor markers. IFA is indirect fluorescent antibody, and that is another way we can look for tumor markers. Ways that we can treat human cancer would be things like chemotherapy, radiation, bone marrow transplants, the injection of lymphokine activated killer cells, immunotoxins, and adjuvant therapy. So chemotherapy, of course, we've heard of. That is when a chemical is used or a drug is used to destroy cancerous cells. And then we have radiation, which I'm sure you've heard of. We've got bone marrow transplants, but the donor must be genetically identical twin or someone who is antigenically similar and who has been without radiation treatments. We've got lymphokine activated killer cells. Some studies say that linking LAK cells to antibodies that seek out and destroy tumors more actively kills cancer in laboratory mice. So that's kind of interesting. And we have immunotoxins, which are antibodies and toxins combined to treat leukemia or lymphomas. And then we have adjuvant therapy, which is the addition of a substance to enhance immune response. For example, the use of BCG vaccine. This is an attenuated strain of Mycobacterium tuberculosis, which is used to treat skin cancer. It actually activates your macrophages. So that's it for tumor immunology. If you guys have any questions, please reach out.